my framework of hand injuries, right? So I'll just, instead of just saying hand injuries, instead of saying hand fractures, we're gonna say hand injuries. So there are so many, but here's the framework. Here's the framework, so you can always think through what is wrong. So what's wrong? What's wrong with this injury? Is a bone problem? Right? Is it a tendon problem? Is it a ligament problem? Now sometimes they're all together, right? Sometimes it's all together. But usually if it's a bone problem, then we have fractures, right? Usually if it's a tendon problem, then we have some type of laceration of a tendon. It's really, you know, and a ligament is usually some type of dislocation, right? So one of the easiest way to think through these type of problems, so you can literally go through and say, even if you don't have a script, even if you don't know how to read the damn script, you can look at someone and really much chunk that information down and say, is it a bone problem? Did that person fracture a bone? Did they cut a tendon? It's a laceration. You have flexors, you can have extensors, you know, whichever one. And then ligaments. Now the ligaments in the fingers, right? In the fingers are very specific. They're very tight. In the DIP and the PIP, and then of course the MP is like totally different, okay? Because it's got more laxity, it's got more movement, right? We're just looking at those fingers. And then of course your thumb is like a whole another animal. It's a CMC, which is, the CMC is pretty much your MP, right? And then your MP is almost like your PIP, and then you have your IP. And this one in the thumb plays a huge role in the stability of how you move your thumb. So any kind of hand injury, this is how you're breaking up your framework that's going to allow you to be able to think through any type of problem that you have. So let's say, for example, we are going to say that it's a bone problem. We're going to go one at a time almost before we say, yeah, it's all together, right? But let's say it's a bone problem and it's a fracture. If it's a bone problem, then could it be a fracture, or could it be a chronic thing like arthritis? You have osteoarthritis, rheumatoid arthritis, different types of arthritis, but these are essentially your bone problems. With arthritis, we know, okay, you know, it's age, it's traumatic arthritis injury, you know, that kind of stuff. And then RA is like a whole different inflammatory. But let's just take a look at then. We're going to break it down even further and just talk about fractures, right? So when we talk about fractures, the most important thing with fractures is knowing how bones heal. Because if you know how bones heal, then you can almost do anything you want. I'm a big fan of doing whatever I want. Patients come in, they ask you questions. You as an occupational therapist, physical therapist, in hand therapy, they ask you the questions. And you've got to know how to respond to them, I think, without always saying, well, let me go ask your doctor, right? Because the doctor is going to respond in a different way, because they have a different approach to fractures and therapy, right? So we as a therapist, we need to know how it works so we can say, okay, well, what's the next move that I'm going to help you with? So when it comes to fractures, we need to know the healing, the concepts of healing of fractures, right? This is going to come straight out of chapter 21 in the 7th edition book. So that's page 264, right? But it really is a short chapter, it's an easy chapter, and a lot of times when I teach and I grab very specific concepts from there, I'm going in there and I'm grabbing the most important things, right? So when it comes to healing of the fracture, you need to know the stages. There's 3 stages. 1, 2, 3, right? The first stage is the repair, or what they can call a reactive. The second stage is the regeneration. And then third stage is remodeling. Now you can take this concept of fracture healing to almost any fracture, right? So when you think about a fracture, you think, well, where is it? You're gonna think, where is it? So today we're just talking specifically in the fingers, let's say, for example, right? Fingers or metacarpals. And we're gonna say, well, how bad is it? How bad is it? I don't know. Right? Did it need surgery? Or is it non-surgical? Right? So where is it, you know, if it's non-surgical, if they broke something, but they didn't need surgery, it might mean that they were not displaced enough. So when a bone breaks, it separates, right? How badly it separates or how angled it is displaced will determine whether it's surgical or non-surgical. If it's displaced, but they could put it back, okay, it's, what do they call it? A closed reduction. So let's say it's broken and it's displaced a little bit. If they put it back and they cast it and they move you a little bit and it stays in place, then they can do a closed reduction, right? But if it's displaced and it's angulated in a certain way where they cannot put it back, then you would need surgery. Does that make sense? Everything with a fracture has to do with realigning. If you break something and it's not aligned anymore and it heals like this, then it can't move the way it was intended to move, and it won't move well. You're gonna lose functional recovery, and there's lots of potential pitfalls that can occur because it's malaligned.